Alright, so I'm going to be talking about cloth mask usage, and I know that there's a lot of questions out there about what constitutes a cloth mask and what we can use to protect ourselves out there. I'm going to go over two different types. One is the simple loop mask, is mainly what we're seeing now. This is made from one of our volunteers that have donated to the hospital. And the biggest points to remember is that this is all about source control. This is to prevent you from coughing, sneezing, and protecting others from you spreading the disease when you may not know that you have it. There is asymptomatic transmission. So the main point of this is to help in situations where you have to be out in public and where social distancing is going to be a challenge. So first I'm going to show the simple loop mask. One of the biggest things to remember is to wash your hands. Before you touch the mask or before you put it on, you need to clean your hands. You'll put the mask on, wrap it around the ears, and it can be a little hard to hear me, so I'll try to get really close to the microphone. Once it's been looped, then you'll make sure not to try to touch the front of the mask. You'll just make sure you have a nice fit around the sides. So you'll see that it goes firm against the face, and it just covers the mouth. It doesn't have to cover a massive expanse, just the nose and the mouth. When taking it off, again, I'm going to wash my hands and take it off without touching the front of the mask. If you choose to make one with ties, that's another option. You'll start again with not touching the mask itself. You'll hold it by the ties. You'll start with the top ties first. And then you'll move down to the bottom ties. And again, it doesn't have to be very tight. It just needs to be firm against the sides of the face here. And again, it's just covering my nose and my mouth. When taking it off, it's going to be the reverse process. You're going to start with the bottom tie first. That way the mask is still covering, it's not folding down yet. And then you'll take off the top ties and remove the mask like so. Again, not touching the front of the mask and not messing with it and rearranging it a lot. That's, again, one of the main modes of transmission is going to be from hands, from soiled hands. So making sure that you're not constantly touching your face, touching your eyes, and adjusting the mask. You'll keep it on until you need to take it off. So we also don't want to see wearing it around the neck or anything like that. That doesn't do any good. It's going to make sure that you keep it on until you need to take it off. A few other things I want to just mention. It is not recommended to put a mask on a child under the age of 2. Babies and infants don't have the ability to remove the mask if they're having trouble breathing. And then if you've ever tried to put a mask on a 2-year-old, they're going to touch their face 10 times more when you do that. So again, it's going to make sure that you are just protecting them from being outside whenever possible, or protecting from being in public groups. You can be outside. In this setting right here, we wouldn't necessarily need a mask if we're more than 6 to 10 feet apart and we're in a pretty spaced out area where the wind can carry droplet particulate. Also, in cleaning these, when you have a mask, you need to make sure that you keep it clean. This can be done daily by just simple soap and water. You can put it in the washing machine and dry it, or you can even wash it by hand. Please do not microwave these. If you microwave a mask, I know that there is a post on social media that talks about microwaving masks. This poses a fire hazard. They will catch on fire, and then you'll have a lot bigger issue to worry about. So just washing, you can air dry them, or you can dry them on low heat in the washing machine. So with that, I'll open to any questions if anybody has any questions. Okay. All right, and not having any, then I will toss to Becky with the health department.
Okay, sorry, I do have one question. If you were to give us a number on how many donated masks you've gotten, what's that number?
That is hard to say. Right now, our staff are also making masks, and we're anywhere to the 200 to 500 a day range with that. But then we've also had our volunteers donate about 2,000,
That's a pretty good ballpark.
somewhere in that 2,000 mark.